Amazing. Thank you so much, first of all, to Lucrecia for the invitation. And it's fantastic to see such a full room. Thank you, everyone, for being here. Can you all hear me okay? Okay, brilliant. So I'm super excited to be here to present this work. I haven't presented it very often, and I'm really intrigued to hear what you make of this. And I also think it's a really great stage for me to be presenting at because I'm mid-analysis, so there's still lots of room to make changes and adjustments. So your comments really have the potential to have an impact on how this work develops. And I'm really grateful that you're taking the time to engage with my work. And before delving in, I also want to say that I understand Spanish perfectly well, so I'd be very happy to take questions in Spanish, but I feel more comfortable responding in English. But please do ask questions in Spanish as well if you're more comfortable doing that. So this project departs from a fairly basic observation, and that is that in the light of dwindling birth rates across Europe, politicians are fairly obsessed over the importance of making more children to maintain the welfare state. This is a telling example from the French president, Emmanuel Macron, who launched what he called a demographic rearmament, no less, in 2024 to address the falling birth rate. And we see similar discourse used in other contexts here from Norway, where we have the former Minister of Finance who also expressed concerns with the population stepping up to replenish the nation. And in interviews from 2024, the minister was worried about how the Norwegian birth rate was lower than the OECD average. And he argued that we need a positive dugnad. That's an incredibly Norwegian word, but it basically means like a collective work effort where we all come together around a shared project to turn this trend around. And on the occasion of Valentine's Day, he provided further encouragement by stating that the initial job of making babies is very fun. Today is the perfect day to kick things off. So it seems fairly clear that the production of children is a political priority because of its envisioned centrality to the economic future of the welfare state. However, it's less evident how the activities necessary to make these children are understood in public and political debate. And whereas there's a really rich feminist political economy scholarship that has argued that the labor of producing and sustaining people goes unacknowledged or is actively silenced in contemporary capitalist welfare states that privilege salaried work over unpaid work, the empirical scholarship within feminist political economy tends to be more concerned with the care work that happens after the baby is born. And this means that we know less about how activities and experiences that form part of human reproduction are understood to fit into the political economy of the welfare state. And this is where I'm trying to make an intervention with this paper. So I'm asking two questions in this paper. The first one is, what role is gestational labor, that is conception, pregnancy, and giving birth, understood to play in the reproduction of the welfare state? And second, what are the potential implications of these understandings for the conditions under which this labor is being undertaken? And to answer these questions, I'm doing an analysis of the political and public debate on the conditions for being pregnant and giving birth in Norway. And Norway is a welfare state in which childcare has been extensively politicized since the 1970s, with the result of the country having a very expansive public funding for social policies such as parental leave and kindergarten and so on. And as you heard from the former Minister of Finance, Norway, like many other European countries, have experienced falling birth rates during the past 15 years. And in 2024, so about 2 years ago, the government appointed what was called the Birth Rate Committee, which was tasked with examining the causes and the consequences of the falling birth rates and propose political solutions to address this. And I'm currently in the process of doing a thematic document analysis where I'm drawing on newspaper articles from the Norwegian Broadcasting Corporation. That's kind of the Norwegian version of the BBC. And I'm looking at what they've written about pregnancy and about giving birth in 2025. And I'm also going to analyze the report that has been published by the Birth Rate Committee, which was just finalized about a month ago in February, to examine how gestational labor is represented in public and political discourse. So, my preliminary argument in this paper is that children are framed as valuable contributions to the maintenance of the welfare state in public discourse, but they are not understood to be products of labor. These are two different things. And the interaction between the pregnant person and the welfare state is primarily represented as one of financial output on part of the state, where the pregnant person is the recipient of welfare services, right? And although kids are understood to represent an economic input for the state, they emerge as a result of bodily processes that are individualized and depoliticized. And a really important caveat here is that this doesn't mean that the public discourse on pregnancy and on childbirth is depoliticized as such, because there's actually a really active debate about the conditions on labor wards and so on. But in this context, the politicization doesn't translate into a politicization of the work that is being undertaken by the pregnant person, only the work that is being undertaken by the medical staff, such as the midwives, for example. And what I propose in this paper is that this inconsistency in the representation of the function of human reproduction for the governance, for the economic governance of the welfare state, can be productively interrogated using the concept of gestational labor. I briefly mentioned it already, and we're going to spend quite a bit more time on it later on. But just for now, it's worth noticing that even though I think this concept is really productive for us, I also think it needs to be conceptualized in greater detail, and that is part of the project that I'm undertaking in this paper to make it fit for empirical analysis. Let's see here. Okay, so I've given you an idea of the point of departure for this paper, my research questions, and the preliminary argument that I'm working to develop. And this is how I'm going to proceed with the rest of the talk today. I'll begin by situating the contribution I'm trying to make in the context of the feminist political economy scholarship on social reproduction, and in the anthropological and sociological scholarship on reproduction. Then I'll present my theoretical framework where I engage with this concept of gestational labor that has been developed by multiple scholars, but Sophie Lewis is one of the persons who've done really exciting work on this concept most recently. But I'm going to read gestational labor through the feminist theorization of emotional labor, cognitive labor, hermeneutic labor, and body work. And I do this because I think it helps us to develop a clearer conceptualization of gestational labor, which I'm going to present to you before I move on to some initial empirical reflections and then wrap up. So, as I've said already, this paper is in conversation with the Feminist Political Economy Scholarship on Social Reproduction. And this is probably well known to many in the room, but social reproduction is a term for all the work that goes into sustaining human life, basically. So it can be everything from cooking, cleaning, childcare, elderly care, and so on, right? And it's not only crucial to the sustenance of human life, but it's crucial to the functioning of the formal economy, right? And it's often unpaid or significantly underpaid. And feminist political economy has made really crucial contributions to the broader field of political economy by expanding our understanding of what questions and what phenomena are relevant for economic governance and political economy as a field. And if we home in on the question of gestation within social reproduction theory, this is really central in social reproduction theory as well, right? Where kids have been conceptualized as public goods that states have clear vested interest in, right? And from the very beginning of this like theoretical tradition, reproduction, human reproduction, was considered part of social reproduction, right? And I think this is a very telling example of that. This is from a foundational text by Silvia Federici, where she says that every miscarriage is a work accident, right? So this idea has been core to social reproduction theory from the start. However, as I was hinting at in the introduction, it is the case that caring for kids after they're born has been more successfully politicized, and it has also been more intensely researched. And this leaves us with a more limited understanding of the political economy of conception and pregnancy and birthing. However, there are other scholarships that have dealt really extensively with empirical social scientific study of reproduction. And some of the ones that I think are most exciting to engage with is the anthropology and sociology of reproduction. And these are obviously massive literatures, so you'll have to excuse that this is very condensed. But sociology and anthropology of reproduction have paid careful attention to human reproduction and its role in economic value chains, right? And particularly, they've taught us a lot about medically assisted reproduction, so surrogacy and gamete donation and so on. An analysis of the commercialization of reproduction has conceptualized this as stratified reproduction. So that is when some people's reproductive desires, typically white, middle class people in the global north, are privileged over other people's reproduction, right? Whilst racialized people in economically precarious situations, often in the global south, but not exclusively, obviously, are relied on to provide reproductive labor such as surrogacy and egg donation and so on. However, this scholarship has been more concerned with reproductive labor that's being undertaken on behalf of someone else and how this labor then becomes monetized and with what consequences and so on. So it is somewhat less instructive when it comes to understanding how human reproduction at large features in the economic governance of the welfare state. And to address these gaps in the literatures that I'm trying to speak to, I have developed a theoretical framework that I think helps us interrogate the political economy of this specific form of social reproduction, which is gestational labor. And gestational labor refers to the activities that goes into conceiving, carrying, and birthing a baby. And as I mentioned, this is a form of social reproduction. So it's not distinct from, but it's a type of social reproduction. So let's see here. I'm missing something in my notes here. Just give me one sec. Yeah. And whereas some of the key feminist theorists who have worked on the concept of gestational labor, such as Sophie Lewis and also Mary O'Brien, who was writing in the 80s, draw very actively on social reproduction theory, feminist political economy has not engaged very much with the concept of gestational labor. And I think that this concept gives us analytical leverage in our feminist political economy analysis because it homes in more closely on human reproduction than most feminist political economists tend to do. because they often pay more attention to care work, right? However, Lewis's and O'Brien's conceptualization of gestational labor remain fairly broad. And I think that for them to be helpful when we do empirical analysis, we need to specify the concept further. And to help me with this, I turn to the feminist theorization of emotional and cognitive and hermeneutic labor and of body work to try to make gestational labor more tangible for us. And I'm going to move on to try to show you how we can read gestational labor through these other concepts and what that does to our understanding of gestational labor. But I want to preface this by saying that I don't think what I'm going to present to you is necessarily an exhaustive list of all the forms involved in gestational labor, but I do think it's a fairly comprehensive one. But I'd be very happy to take your input on this if you think I've missed something important. So. We'll begin with emotional labor, that I think might be the concept that resonates with most people, or that people might have heard of already. It was developed by sociologist Arlie Hochschild in the 1980s, and it refers to the work that employees perform when they manage their emotions to meet other people's expectations of what they are owed, following from the role that the worker is performing. So when the worker is modifying their feelings, for example. A classical example that Hochschild uses is that of the air hostess, right? Who, as a part of their work, also does emotional labor to meet the customer's expectation, right? And another concept I think is really useful to understand gestational labor better is the concept of cognitive labor, also called the mental load. And here I draw on the work of sociologist Alison Daminger, who's done really interesting research on cognitive labor in the context of American heterosexual couples managing a shared family life. And she defines cognitive labor as all the work that goes into organizing, planning, facilitating, and overseeing family life. And next up, we have the concept of hermeneutic labor. This was developed by feminist philosopher Ellie Anderson, and it refers to a gendered, burdensome activity of understanding and coherently expressing one's own feelings, desires, intentions, and motivations, discerning those of others, and inventing solutions for relational issues that arise from interpersonal tensions. And Anderson developed this concept to try to analytically separate between the management of emotions, which is Hochschild's idea of emotional labor, and the interpretation of emotions, which is this idea of hermeneutic labor, right? So it's distinct from Hochschild's concept of emotional labor. And then lastly, the concept of body work is obviously also very useful to us when we think about gestational labor, right? So it centers the body, it's all of the physical work that's involved in these processes of producing a human being, right? And I should say that I'm not the first person to try to apply these concepts to processes related to human reproduction. Several of these concepts have been employed to make sense of how heterosexual women manage the project of sex for the purpose of pregnancy, for the purpose of conceiving, by undertaking various types of body work and emotional and cognitive labor. Or how pregnant women undertake emotional and aesthetic labor in the workplace when they face unsensitive comments by coworkers, for example, or try to conceal pregnancies in their early stages because they don't want to share those news, for example. But I think what separates this project a little bit and what I'm trying to do here, right, is to connect what is primarily micro-level empirical sociological work on reproduction with the feminist theorization of gestation as labor that is central to the economy and the state for the purposes of undertaking political economy analysis, right? So next, I'm going to try to work on this conceptual clarification of gestational labor, and I'm going to try to show you, try to convince you why it makes sense to use the theorization of the 4 types of labor that I've just gone through to think about gestational labor and try to refine that concept for us, right? And I think gestational labor entails emotional and cognitive and hermeneutic labor as well as body work. And I'll give you some examples of what I think that might look like, right? So when it comes to emotional labor, we see gestating people negotiate the discrepancies between their own feelings and the societal narratives and expectations of what pregnancy is supposed to be like, and other people's demands in their interaction with people who are pregnant, right? And cognitive labor can pop up at all stages of conception, pregnancy, and birth. And the more reproductive labor that intended parents need from a third person, for example, if they need medically assisted reproduction and so on, the greater that cognitive labor is likely to be, right? So this is just a few examples. It can be everything from tracking ovulation, initiating sex when conception is most likely to take place, keeping track of IVF and prenatal appointments, researching and acquiring baby-related items that you need, monitoring the pregnant body as well, right? Researching and following recommendations for what to eat and drink and so on and so forth. And hermeneutic labor in the context of gestation, I think involves understanding and expressing one's own pregnancy in relation to potential co-parents, to family and friends, but also to employers, to colleagues, and importantly to medical personnel who are in a position of power by the virtue of their expertise and them being gatekeepers to treatments and medication, right? And hermeneutic labor, I think, is particularly likely to be more pronounced for marginalized pregnant people who don't fit into preconceived ideas of what a pregnant person should look like, or ideas about motherhood, how one gives birth, exactly. And people who overall have a harder, or who have to undertake hard work to make themselves legible to medical staff as well as to the broader society. So I'm thinking, for example, of trans and non-binary pregnant people, right? And lastly, but the one that I think requires less explanation as well, is the body work, right? And I think this is fantastic British understatement. So the British National Health Services, the NHS, they write on their web pages when they describe labor and so on that when you're pushing a baby out of your body, it is hard work, which I think is the understatement of the year. But this can be anything from, giving birth, breastfeeding, morning sickness, heartburn, pelvic girdle pain, trouble sleeping, hormone injections, embryo insertion. It's a long list, right? And what I think this does for us, this reading gestational labor through these concepts, is that I think it helps us develop a clearer idea of what gestational labor is, thus also making it much easier to apply it when we undertake empirical analysis. And this is where I'd now like to turn. As I mentioned at the beginning, I'm very much in the middle of the analysis, so these are very preliminary reflections. And these reflections are based on the newspaper articles that I mentioned from the Norwegian Broadcasting Corporation, where I've selected articles from 2025 that have been classified by the news agency, so they've been tagged as having to do with pregnancy or giving birth, labor. And I'm going to continue working on this material and then also work on the report from the Birth Rate Committee, which was just published, but which I haven't had a chance to work on yet. So when it comes to how gestational labor is framed in the public debate, there's a tendency to give labor, the act of giving birth, a lot of the attention, and conception and pregnancy feature less in the material. And birthing is quite often framed as a scary event, right? And I think so. This is a title from a news article where I think the NRK, the Norwegian BBC, understood that they'd been publishing a lot of fairly negative articles because they published a separate article then saying, "Are you overwhelmed by negative news about birthing? Here are 5 good birthing experiences," to outweigh this negative coverage. And there's also a tendency to foreground medical treatment and medical conditions in the data material. So there's a fairly medicalized discourse overall. And in Norway in 2025, there was also a really intense debate about unassisted home birth. So when you give birth at home, but without any medical staff present, so no midwives and so on, right? And quite often, pregnant people appear as patients in this material, whilst the actors who are performing work are the midwives. And when it comes to minoritized people's experiences with gestational labor, they're first of all not particularly present in the data material. But when they are, they're often performing more demanding gestational labor. And here are a few examples. So I'll just read 1 or 2 of these quotes. Women who've lived in Norway for a short time are more likely to experience complications during pregnancy and childbirth. Differences in culture and language, as well as a lack of trust, mean that this group is more likely to undergo emergency C-sections, experience severe bleeding, and have stillbirths. And so this is from the next quote I'm reading is from an article about a prominent Paralympic athlete in Norway. And it reads, "Now that she's become a mother, there's lots of stuff to figure out. Not everything is adapted to mothers in wheelchairs." And fairly unsurprisingly, increasing the Norwegian fertility rate is seen as a really important societal project, right? And sometimes this is very explicitly connected to the economic governance of the welfare state. And other times it's more kind of underlying, right? So an example where it's very explicit is the first one, where you see few births means fewer hands and taxpayers. And that's something the politicians are concerned with, right? But we see other examples as well where it's underlying, but maybe not as explicit, such as this one, right? Where it says, "And even though the birth rate is now rising slightly because there's been a little bump over the last couple of years in Norway, it remains too low. According to Statistics Norway, the fertility rate in Norway is still only 1.44 children per woman. For a country's population to remain stable without immigration, the fertility rate must be approximately 2.1 per woman." And lastly, labor is often presented as an expense for the welfare state. And here are but a few examples of that. Essential women's health services are being cut as healthcare providers look to save money. Unfortunately, this is having a negative impact on women's health and maternity care. Another example, the one in the middle, the closure of the ABC clinic. This was a really popular midwife-led labor ward in Oslo. was due to financial considerations and a shortage of midwives. She believes that while not all, many of the women giving birth at home would have been able to receive care if the services offered at hospitals had been more varied. So I'm not sure for how long I've been talking, Lucrecia.
30 minutes more.
Perfect. Well, that's great timing on my part, because I think it's time for me to wrap up. In this paper, I've argued that children are framed as valuable contributions to the maintenance of the welfare state, but they're not understood as products of labor. And I think that the concept of gestational labor helps us identify this discrepancy, which makes it a very productive concept for political economy analysis. And what I'm going to do after this is I'm going to conclude my analysis, and I'm hoping to submit to New Political Economy. But if you have any other brilliant suggestions, I'm also happy to take them. And I wanted to mention a few things that I've been thinking about as I've been preparing for this presentation, but I'm also super happy to take comments on anything and everything. So you don't have to relate to this, but it's just to let you know where I'm at the moment. So I'm quite curious to hear if you're convinced by the usefulness of gestational labor as a concept to undertake these kind of analysis. And I'm also curious as to what you make of this reconceptualization that I'm trying to do, because that's a fairly big part of the paper as well, right? When I read gestational labor through these other forms of labor. And lastly, and this is a classic for anyone working on gender, I want to speak to a generalist political economy audience. And I think that this, as it stands, maybe reads as too soaked in like feminist theory to be able to do that. I'm not quite sure. So I'd be happy to take input on that as well. Thank you so much for the attention, and I really look forward to the conversation.